And hello, everyone. I'm Kira Phillips. We're coming on the air with breaking news. A CDC advisory panel just voted to restrict COVID-19 shots for all Americans. The committee instead advising individual decision making. The panel, including a dozen vaccine skeptical advisors handpicked by Health Secretary RFK Jr., already made its first change yesterday, voting to separate the vaccines that fight measles, mumps, and rubella and the virus that causes chickenpox. None of these decisions will be finalized, though, until the acting CDC director or RFK Jr. signs off. But top medical organizations are already urging parents to ignore any advice coming from the panel. For more, let's get right to our medical correspondent, Dr. Darian Sutton, along with senior White House correspondent Selena Wang. All right, Dr. Sutton, let's talk about, what this means, your reaction as a doctor. Let's talk about the decision that was just made.
My reaction as a physician, the accessibility to COVID-19 vaccines, it seems as though it remains. So the CDC Vaccine Advisory Committee has voted to has voted to unanimously allow those who want to get a vaccine based off of individual preference. A key point here, Kira, is the discussion on whether or not prescription was needed. Now, it was discussed at length during this advisory committee meeting on the risk of requiring a prescription, because as many of us know, getting a prescription adds another barrier to access. There were some who were for prescription, but it seems as though it came out at the end of it that understanding that adding a prescription would create a barrier to access. And so the vote was done. And now there is not a prescription that is required to get a COVID-19 vaccine. So essentially, a person can walk into a pharmacy, as 90% of those who got vaccinated with COVID have done in past seasons, and get vaccinated without a prescription. But they do emphasize on discussing the risks and benefits of COVID-19 vaccines, which essentially is what has been done in history. I think that they're trying to make sure that those providers who are providing these vaccinations have a more discreet conversation in terms of the actual risk and benefit based off of the individual. But again, this is something that is constantly discussed with patients. I do it in the emergency room, and pharmacists do it every day with patients.
All right, so let me ask you a question, though, Doc. If the CDC advisory panel, vaccine advisory panel, voted to abandon its recommendation for the COVID-19 and is saying it's a personal choice, we're not recommending it, it's a personal choice, does that mean, since it's not recommended, that patients will have to pay out of pocket for this?
And that is still the crucial part that is still we're waiting to fully understand that. Now, that might come down to a state level decision in terms of the access based off of insurance coverage. Also, what type of insurance do you have, whether that be a private insurer, Medicaid, Medicare, or otherwise. That is something that is yet to be fully determined. And yes, if that does come down to, unfortunately, compromising insurance, then that creates another barrier to access. So we'll be closely monitoring this to make sure and understand and have full awareness over whether or not insurance providers will cover COVID-19 vaccines. Now, we've seen throughout this discussion in the past week as well that insurance providers have already stepped up and stated we're going to cover the COVID-19 vaccine, but that might not be the same for each person, and it might depend on their state. These details are yet to be fully determined.
Got it. All right. So, Selena, any word from the White House?
No word from the White House, yes, but throughout all of this controversy around RFK Jr.'s efforts to overhaul our nation's vaccine policy, President Trump has maintained his support and backing of Kennedy. In fact, I had asked President Trump recently after Kennedy had testified on Capitol Hill, asking him if he still had confidence in Kennedy given all of the pushback we're seeing, in fact, bipartisan pushback to what he's doing. And the president told me that he likes the fact that Kennedy is different and brings different ideas to the table. But what's also interesting is that the president has also frequently touted Operation Warp Speed, which was that effort to rapidly develop vaccines during the COVID-19 pandemic during the president's first term. He's also said before that some vaccines just work, pure and simple. There shouldn't be any controversy about it. But Kira, there's also been notable pushback from lawmakers, especially from Republican Senator Bill Cassidy, who's the chair of the Senate Health Committee. He is telling the American public that they shouldn't trust any of the changes that come from this CDC advisory vaccine panel. And lawmakers and medical groups, they have for weeks been sounding the alarm about this very panel, because earlier this year, Kennedy had ousted all of the existing members and replaced them with his own choices, many of whom have shared and expressed vaccine skeptic views, Kira.
All right, Dr. Sutton, Selena Wang, thanks, guys.